that really is really powerful when you are able to reach that level of healing.
Hello, you're listening to The Rare Life. I'm your host, Madeline Cheney, and I have episode 25. In this episode, I chat with my former licensed therapist, Rosey Shaefermeyer, about EMDR therapy, which is a clinically proven and very researched form of trauma therapy. And I will share how it has transformed my life. I'm super excited about this episode. But first things first, now that we are into December, we get a new question of the month. And it is, what is your favorite quality that you have gained because of your child? One more time. What is your favorite quality you have gained because of your child? Head over to the website, therarelifepodcast.com, to answer this month's question and to see the compilation of November's answers, which, as a reminder, was advice for parents who have just received a diagnosis for their child. So go over there to check that out. And if you aren't following me already on Instagram, that is a great place to also answer the question of the month. You can follow me at the_rare_life. In preparation for this episode, I reached out to a company called BetterHelp because I thought they would be an awesome company to sponsor this episode. We're getting real up in here because we're talking about therapy. They are an online service that offer 4 ways to get licensed counseling virtually. They offer licensed counseling through video sessions, phone calls, live chat, and messaging, whatever you're most comfortable with. And so they're just really the perfect fit for those of us who have children with such complex needs, where it is hard to find childcare, and especially in the time of COVID. As part of the process of signing up, you get to go through a questionnaire where they can help match you with the ideal counselor. And after this episode, if you're totally sold on doing EMDR therapy, which I really hope you are convinced of that, I have such a passion for that, then you can even request a therapist that is licensed in EMDR therapy, and you can do it through your BetterHelp subscription. They are also more affordable than traditional counseling. And if you use the affiliate link in the show notes, then you get 10% off your first month, and it also helps sponsor this podcast. They also have financial aid available for those who qualify. So there really is nothing holding you back. If it's been hard to find childcare and it's been hard to find something that's affordable, I encourage you to look into this and take care of yourself. So head to the show notes if you're interested in looking into that. Okay, so back to EMDR. I am so excited to share this episode. This is actually one that's been in the makings since I conceived this podcast. When I was just formulating all my ideas for it, I knew I had to do an episode about EMDR therapy because of how much it's changed my life. Before I went into therapy, I was zombie mode. I was not myself. Kimball was 18 months old, and just all the trauma and the pain of everything we were going through and had been going through, I just felt like a shell of myself. I was not Maddie, and I had zero energy. I was bone tired from all the grief and the pain. And when I went in to see Rosie and I started this therapy, it took a few months to work through my grief and my trauma, and it helped me feel empowered, and I felt strong, and I felt capable, and I felt like myself again. And it also is why I thought, hey, I should make a podcast about this and help people and help share each other's stories. And so you can see why I'm so passionate about it. It's really changed my life. And it's interesting to me that I had this interview scheduled for a while, and it came up where, you'll hear this in the episode, but I interviewed Rosie the day I started miscarrying for the 4th time. So I was obviously having a really, really hard time with that. So it was good to connect with her on the day of this heartache. It's been about a week as now I'm recording the intro for this, and I have gone back to zombie mode. I felt zero energy. I just feel stricken with grief. It's been really, really hard. This one's hit me harder than the other ones. And I feel myself slipping away again. And it's interesting timing because it's kind of like going from the before and then the after and going back to the before and saying, oh my goodness, I used to be like this all the time because of everything we went through with Kimball. And then I was able to get through that. And so I can tell you, if I can't get through this grief and I feel stuck in this mode after a reasonable time to grieve, I will go back and I will do EMDR. And it's great to have this tool in my toolbox because I don't want to go back to how I used to be. I don't want to go back to grief-stricken Maddie, stuck in that cycle. So again, I'm really excited about this episode, and I really hope you catch on to that passion, that excitement that Rose and I both have for this method of trauma therapy. So a little bit about Rosey. Rosey is a licensed clinical social worker. She has been treating patients with EMDR for 6 years, and she currently works as an EMDR consultant for other therapists learning EMDR. And I will say, too, on a personal note, I love Rosey. She helped me through some really hard stuff, and my life is so much better because of the work that she did with me. Rosey is a lover of food and cycling. Let's jump right in. Rosey, thank you so much for joining us today.
Thank you. This is exciting and a little nerve-wracking for me. I just never done anything like it.
Yeah, I'm excited to share your expertise and we can talk about our love of EMDR trauma therapy. So when I sat down with you initially, I remember I explained my story and how I came into you because my grief was interrupting my sleep and how I was getting like 3 hours of sleep a night because of all this trauma and things in my past that I was dealing with having to do with my son, Kimball. Mm-hmm. And you said, well, we could do talk therapy or we could do EMDR, which is a trauma therapy that is really effective at just clearing things up. And I was like, let's do that. And I'm really glad that I went to you and that you believed so strongly in EMDR because I had such huge success with that. So I would love to hear from you. Why is that one of the first things you offer to patients? And why was that something that you thought would fit for me?
So it's not always the first thing I offer to patients, but it often is because I do really believe in EMDR and its ability to help someone move forward from something when they're really stuck. And so when I met you, Maddie, it seemed pretty obvious to me that between your grief of losing your dad, as well as the grief with having to adjust to a life you weren't really planning on, I knew that EMDR would be a really great fit because you just were stuck and you clearly, besides that, were living a life that, is healthy and effective, but it was like your brain just didn't know how to move past that. And so I knew EMDR is a great fit for her.
Yeah, totally. At the time before I came to you, I was really stuck. I felt very victimized and like poor me and just so low energy. And I just wasn't myself. And so since then, I've felt very empowered because I was able to deal with it and store it properly. And I love that, like the effectiveness of it and how it only took a couple months of me seeing you, maybe 3 months at most, and doing EMDR sessions where I felt like I could move on from it and put it in a healthy place.
Right.
And so that was really great.
Yeah. It's also very common when I first meet with someone that EMDR would definitely be indicated if there's sort of an obvious theme that's really disrupting their life. And then with that comes symptoms. So for example, you sort of mentioned, I felt very victimized. I felt like I'll never be okay again. And I could sense in talking to you that wasn't your lifelong norm. And so again, that was evidence that she feels stuck. She feels like she can't not think this way, even though she really wants to think this way, that you're not a victim. It felt obvious you couldn't not think that way. And so again, EMDR was definitely indicated there.
Yeah. Yeah. And I think it brought me to the opposite spectrum that not only did I not feel victimized, but I felt like I should make a podcast about this and try to help other people through it.
Right.
So I think
So
that's like, that shows like the power of it, where I was able to go from feeling victimized to feeling really empowered and not only for myself, but for helping others. And I think that's
Right.
a really cool benefit of it.
Yeah, I remember actually a turning point with you, Maddie, where you came in and
Mm.
you said, I want to do something for other people who are dealing with this. And at that time you were playing with the idea of like making clothes for kids with special needs. And
Oh, yeah.
anyway, it's so cool because I do feel like this podcast is evidence of the progress you made. So,
Yeah. Yeah. Like total healing.
yeah.
Totally. So I've been researching more about trauma and
Hmm.
trauma therapies. I've been reading a book called The Body Keeps the Score. Have you read that?
I have.
Or
That's a great,
okay.
great book.
Yeah,
Yeah.
it's a little dense for me. I'm like, well, I need to skip
It,
over these like brain,
that's true.
anatomy.
It's
But
probably written to therapists, really. I mean, it's not,
yeah,
but
yeah, yeah.
yes, as a
It's
therapist, I loved it.
very clinical. Yeah. But
Yeah.
in it, he talks about these patients with PTSD. And I was like, man, I'm not even close to this. Like my trauma, how do you define trauma? I guess that is my question. And how would someone know if they should do trauma therapy in something like EMDR?
That's a great question. So, in the field of EMDR, they actually define trauma pretty specifically. And the way they define it is anytime something happens that the brain is unable to reach an adaptive response to.
Hmm.
So that could include a million things, right? And they actually do use verbiage in EMDR. They'll talk about little T traumas versus big T traumas.
Oh, okay.
Um, so meaning a little T trauma, right, would be something that is seemingly less significant, where a big
Mm-hmm.
T trauma would be more significant. But it's interesting because you find as you work with people that often those little T traumas are just as significant in the disruption of the person's life.
Hmm.
And it's interesting because a lot of times when I meet with people who don't have any seemingly huge traumas by the definition of the world or something, I
Right,
don't know,
right.
they sometimes feel maybe ashamed that they're struggling, or they feel like they shouldn't be struggling. But the fact of the matter is, if the brain hasn't found this adaptive response to this stressor they've gone through, then it is traumatic and it is impacting them. So to me, if you've
Mm-hmm.
gone through a stressor that is impacting the way you function now, you're dealing with trauma and you deserve healing.
Yeah. How would you define that? What are some examples of a way it would disrupt? Like I mentioned, I wasn't sleeping well. And I know that's a
Hmm.
big one that a lot of people
Yeah.
experience. What are some other symptoms of trauma that needs to be dealt with?
Yeah. So a lot of times it will look a lot like depression or anxiety. So
Hmm.
loss of appetite, you're isolating yourself from people you normally enjoy, you're doing activities less that you enjoy. It may just be disruptive in your relationships as a whole. So people who you normally feel close to, you don't feel close to anymore, or you feel this distance from everyone in your life who you care about.
Mm-hmm.
You may also experience major mood shifts than you're used to and wonder why you're suddenly angry all the time or agitated
Mm-hmm.
all the time. It may also manifest itself with anxiety, which would include avoidance of places and things, and you mentioned
Mm-hmm.
sleep. So lots of different things could be an indication of trauma.
Yeah, that sounds a lot like grief too. Do you feel like those
Yeah.
are really related?
Yeah. So that's also a great question. Always during EMDR at some point, you know you're doing the work well if the person sort of meets their grief and they
Hmm.
sort of recognize things that they lost because of what they experienced. And sometimes
Hmm.
the things they lost aren't actual people or things, but it may be something they thought would happen,
Yeah.
or how they thought their life would go, or how they thought their child's life would go, or whatever.
Mm-hmm.
But those would be examples of things that need to be grieved. And to me, grief is necessary because that is a validating experience. When we grieve for ourselves, we're sort of telling ourselves what you feel is real. It
Mm-hmm.
matters. I care that you feel this way, right? So it
Yeah.
really is a necessary component. Uh,
Yeah.
like that will happen during the process of EMDR at some point.
Yeah, totally. In fact, you told me while we were counseling together that I needed to recognize my grief and my pain because I would just keep shoving it aside and putting it in a box because it was kind of survival mode. Like, no, I can't deal with that. I need to do all these things. And
Right.
so that's been something that's been really helpful is just remembering, no, I need to recognize that this is painful and that it's hard, grieve
Hmm.
it and be sad, and then move on and be like, oh, I'm strong because I'm able to deal with this even though it's so painful. And so actually today, I didn't tell you this before we started recording, but today I started miscarrying my fourth pregnancy that I've lost. So that's been an interesting time today to kind of reflect, like, okay, I'm going to talk to Rosey today. And we talked a little bit about miscarriages when we met together, but just letting myself be sad has been really powerful. It's uncomfortable to be sad, and it's uncomfortable to recognize the pain, but it's very validating. And you're able to deal with it, I think, in a healthier way, and then kind of move on and have closure.
Right.
So I appreciated that.
Yeah, I'm so sorry to hear that. First of all, I really am.
Thank you.
One other thing with that to think about is, imagine if another person were sharing their deepest pains with you, and imagine if your response to them was to ignore or to tell them like, I don't want to hear it right now. Right? That's like so often what we do to ourselves with pain, because, well, frankly, because we don't want to feel the pain, right? So it's kind of a defense mechanism. But if we think about it from an outsider's perspective, it's really very invalidating when we don't recognize our pain and allow ourselves to feel that pain.
Yeah, I really like that. That reminds me of toxic positivity, where people say, oh, but at least, or, and that's just so, you're like, well, I'm not going to you anymore to vent, because that's so disrespectful to the feelings of the person, whether it's to yourself or to others. Yeah.
Very true.
So diving right into EMDR, a lot of people, when I've actually been asked, like, how are you making a podcast, or how do you talk about all this trauma you've had with your son, all these really hard things? And he's only 2 years old. I tell them, it's EMDR. That is why I could talk about it and feel like I can deal with it in a healthy way. And I can think of it as this thing that happened to me, but something that's not controlling me anymore. And then they'll say, what's EMDR? And I'm really bad at describing it. So I would love you to describe what is EMDR and what do those letters stand for?
Yes. So it's a terrible name, if you ask me. In fact, I heard once that the woman who created it sort of regretted later that that's what she called it. But by the time she felt that way, it was, it's too late. So it stands for eye movement, desensitization, and reprocessing. So it does, in the title, technically sort of describe what you're trying to do. You're trying to desensitize someone to an experience and then reprocess that experience.
Okay.
So what does EMDR really do? Well, the goal would be, we're identifying where you're stuck, and then we're trying to re-look and re-feel that experience to see if you can conclude something else. So I think a really obvious example of what EMDR therapy does is to think about someone who's in a car accident who suddenly feels unable to drive, right? So they've always been fine driving, and then I'm in this car accident, and now I avoid driving, I avoid going near the location where I drove, right? And so the idea with the EMDR would be, okay, this clearly was an experience that their brain was unable to fully process. So we're going to reprocess it in EMDR therapy. So the person would come, and the eyes are following the therapist's finger from left to right. And the idea is that you're kind of copycatting the process of REM sleep, when the eyes move during sleep. And we know that when that happens, the brain is processing much more quickly and much more effectively. So when you and I are talking, we likely are only accessing certain parts of an experience. So we may be thinking and talking about it, but maybe we're not feeling it in our body as much, or maybe we're not having the images of it. But when we do EMDR, for some reason, those eye movements allow our brain to think about it in a bigger, more effective way. But so with the car example, after EMDR, the goal would be that the person feels differently about themselves in that car accident than they did when they started. So instead of believing I can't be safe when I drive, they end therapy feeling like I should be cautious, but I can make choices to keep myself safe, and I can keep driving, right? And so then they're able to drive, and they're able to continue the way they were before, and hopefully maybe even feel more confident and more effective. So,
Yeah, because you see yourself the victor at the end of that.
right,
Because I think you're really able to, like you said, with the whole process of EMDR, you really are feeling all the emotions of that really negative experience. And then by the end of it, you're able to say, I'm victorious over that memory or that traumatic event,
right,
and I can move on with my life.
right. Totally. Yeah. So again, you're desensitized to the experience, meaning it doesn't hold the same power, which you mentioned earlier, that like I can talk about things because they don't hold the same power for me. So you're
Mm,
desensitized, but then the other goal from EMDR is I just feel differently about myself because I've reprocessed this experience.
yeah.
Part of the theory with EMDR is that the brain, so this is what actually really drew me to EMDR, is that the belief system behind EMDR is that the brain is capable of healing itself. So
Mm,
as a therapist, I love that because it's the power to heal is not in my hands as the therapist, because why in the world would I be able to help people with a million different difficulties they're facing? Why would I have all the answers for them? I don't.
right.
But in EMDR, the belief is the brain was designed to heal. And sometimes the brain gets stuck, and we are essentially initiating a process in the brain that helps activate that natural healing system. So that's
Yeah.
something I really appreciate about EMDR.
Yes. When I am talking to a friend or something and sharing how much I love EMDR, say I love it because you fix yourself. Like go
Yeah.
fix yourself. Go do the work for it and you untangle all the messiness in your brain and
Right.
put yourself in a healthier spot. You can move on with your
Totally.
life,
Totally.
which I really can get behind.
Me too.
What
It's
would
empowering.
a common EMDR therapy session look like? So say I'm your patient, I'm coming into your office for an EMDR session. What would that look like?
So you would come in, I would first ask you, we're always starting the session by looking for how symptoms that we're trying to change are going. So like in your case, you wanted to be sleeping better, you wanted
Mm-hmm.
to feel less victimy, right? So we're checking in on like, how did that go this week? Is that getting worse? Is it getting better? So that's how we would start. So it would
Mm,
start maybe feeling more like a talk therapy session where we're talking back
right.
and forth. But generally, we wouldn't want that to last very long. We would want to then move into the reprocessing stage of EMDR, which would be we choose a memory that was very stressful to you that we would have identified in a previous session. And then we basically set up that memory. So I, as the therapist, want to sort of activate some of the feelings that you hold with that memory. So I would
Mm,
ask you some questions that would bring up those feelings. And then once we had activated that memory, we would start the eye movements where my hand goes back and forth and your eyes follow. And you do that in chunks of like 30 seconds at a time. And then I'm constantly checking in with you about what's happening.
mm.
And then we do another set, and then I ask you again, and then we do another set. And we basically do that until we start to see your brain shift, how you're feeling about yourself and about the situation. That's
Remember,
like a rundown of the basic premise.
yeah. And I remember you would check in with me, would rate my, on a scale of 1 to 10, my, what would you call that? A
Yeah, so we would
stress
ask on
level.
a scale of 0 to 10, where's your distress level? And so generally when you start the memory, it's pretty high. We
Mm,
actually don't move from the memory until you've reached a 0. So that's something
right.
as a therapist I like about EMDR is there's lots of ways for me to kind of check my homework. Like, am I actually helping this person feel
Yeah.
differently about this thing? So yeah, that is
Yeah.
part of it.
And I think that's so cool because I remember we did that a few times. Like, okay, we completed that memory because I was able to say, yeah, I can think about it without any distress. I feel sad
Right,
or, like those kind of feelings, but I don't feel any of the distress.
right.
And we could move on to another memory that needed to be worked on. And I think that's really cool. And just
Right.
really quick too, as an example, when you talked about the trigger memory.
Uh-huh.
So when we picked ours to deal with Kimball and all of that experience, I picked when we first found out that he had issues with his body at his 20-week ultrasound. And so that's kind of the memory we kept checking in on. But my mind would go to other places that were related, but I may not have been aware that were related. And I was able to come to other conclusions. So do you have a more scientific way to like describe what was happening there?
Any more scientific way. I mean, essentially that's again, when we do eye movements, the brain reprocesses in a way that it doesn't when we're just talking. And so it is amazing. And that's very normal for the
Mm-hmm.
brain to start. Basically, it's finding any associations with how you felt during that experience. So it's almost like the brain categorizes, like, I remember anytime I felt like I wasn't lovable, right? And so
Mm-hmm.
as you start going, your brain may remember, like, well, I remember this one time when I was a kid and these kids were really mean to me, right? And a lot of times just acknowledging that is enough for your brain to go, oh yeah, but that's not true. Sometimes it's
Mm-hmm.
its own memory that we have to target, and we will later on. But
Mm-hmm.
my scientific explanation is the brain makes associations. It basically clumps into, we call them memory networks in EMDR, that there are memory
Mm-hmm.
networks, and it's a network of memories that, in the case of trauma, these memories have all sort of concluded something negative about you. And so we're trying to clear up that memory network so that the memory network is associated with something positive about you, something true about you, not
Right.
something not true that
Right.
was the result of trauma.
Yeah, because I remember you would ask me that periodically. What do you believe about yourself because of that? And at first, I believed I was weak and then I
Hmm.
couldn't handle it. And then by the end of it, I was like, no, I'm strong. I've endured a lot. And so that is it. Even that right there is such a life changing switch to go from thinking that you're weak to that you're strong, recognizing, well, I went
Right,
through all this and here I am.
right.
So I love that part of it.
Yeah, me too. And part of EMDR too that I also love is it's not just that you can think that you're strong, but it's almost like you feel that in your body, like your whole body
Hmm.
has made this transformation for, like, I don't doubt that I'm strong anymore. I know I'm strong. I'm not weak. That's not what's going on. Right. And
Yeah.
that really is really powerful when you are able to reach that level of healing.
Yeah. Yeah, because a few times you'd call me out, like for one of them where I felt selfish. And I was like, well, I'm not selfish because I'm a mom. And I listed off all these things. And you're like, yeah, but do you believe that? And I was like, no, I'm totally selfish. So I remember like that you're able to really call yourself out, like, well, what do you really believe about
Right.
yourself? And then you
Right.
can change it from its core
Yeah.
instead of just telling yourself things that are logical, but you may not really believe.
Right. And that's part of what EMDR is designed to do, is like, even if you logically know something, we want to help you feel that something.
Yeah. Oh, I love that. That's so cool. So, when looking more at your professional information, there was a lot on there about your work with EMDR and that you even train other therapists with EMDR. What is it about EMDR that draws you to it? You've mentioned a little bit, but really, why do you believe in it so much and what has caused you to believe in it so much?
So I really do believe in it a lot. I want to shout that from the rooftops. I'm a really, really big fan. You're right. I've devoted most of my career to learning EMDR and teaching EMDR. I think for me, why I love it so much is, and I mentioned this earlier, but the theory behind EMDR is that human beings are designed to thrive, and they are designed to be strong and to heal. And so I love in an EMDR session when it's like the person's brain finally hooks up with the truth about who they
Mm,
are. And if a person will stick with EMDR, they will find that. Like, I really do believe EMDR does work. It's sometimes very difficult to make work because there's lots of factors. Brains are often very defended as we work with them. And
mm,
so they may kind of fight the process, or they have difficulty accessing memories or feelings or whatever. But if
mm,
someone will stick with EMDR, the reason I love it so much is I really do believe the person will be able to connect with that ability to heal themselves. And I just, as
mm.
a therapist, you can imagine when you're working with people with all kinds of problems, it could become really discouraging if you felt like you weren't able to help people.
Yeah.
And so for me, when I found EMDR, it was sort of like, oh, this is something that makes sense and that does work.
Yeah.
And if people will stick with it, and if I will help them to jump over hurdles, they can heal. And so that's the fast answer as to why I
Yeah.
love EMDR.
Yeah. It's such a powerful tool.
Yeah.
That's so amazing. What would you say to a listener that may say, yeah, but I don't have time for therapy? Because a lot of parents that listen are parents like me where they have children with a lot of special needs, with a lot of therapy appointments and medical appointments and just a lot of needs. And that is hard for them to get to therapy or even to afford therapy because, there's a lot of medical bills that are often associated. What would you say to someone who says, but I'm too busy or I can't afford it?
I would say, I'm so sorry because you deserve the help. And I believe that there are people who are so busy that may feel impossible. And therapy is definitely expensive, though there are ways around expensive therapy. Most therapists will see a few people on their caseload at any given time at a discounted rate. So if that's your reason, if you look hard, I bet you could find therapy.
That's cool.
So I do have ideas for people who you had asked me this question before we started, and I did have some thoughts of like, what are things people can do to at least try and prioritize themselves when they're dealing with this kind of stress. So a big one to me is the importance of asking for help. That's a really, really hard thing. And it's a skill that all of us need to learn, no matter what our circumstances are. So one piece of advice is ask for help. So maybe in some cases that might mean finding someone you can teach who can help care for your child so you can go to therapy. Maybe that would be an example. Or maybe you're not comfortable with that, but you are comfortable with having someone you can just talk to about your stress, just a friend. But one is asking for help is so important. Another big one is mindfulness and meditation. It's awesome. We have resources with that on apps and on YouTube. There's just unlimited resources with mindfulness and meditation, and it really can make a huge difference. And we're talking, finding 15 minutes a day where you're practicing that could make a big difference.
Yeah.
And then my other thought I had to help people who may not be able to afford or have time for therapy is just the importance of learning to set boundaries, just meaning learning to tell people no when you need to, or learning to tell people yes when you need to. And then lastly, just take good care of your body. Try to get good sleep. Try to eat well. Your body and your mind really are so connected.
Right. Right. And even that can be so hard when you're stuck in that place where you need help. Where it's like, no, I just want to eat a whole cake, or the energy to, summing up the energy to go exercise might be all you can do. But I think it really does come back to taking care of yourself and loving yourself, just like you love so many other people and care for so many other people.
Right.
So you see my mom, because I referred her to you, over telehealth. And you even do EMDR with her over telehealth. And I know that it's not recommended. EMDR is better in person. But what has been your experience with that?
So if anything good's happened from COVID for EMDR, it's that the EMDR community has realized like, oh, this actually works quite well via telehealth. And there's already been people starting to research what that looks like, and lots of therapists sharing their experience. So the good news is there actually is, a lot of indication that EMDR can work well via telehealth. For me personally, everything via telehealth it's just harder to connect with someone via screen, right? So, but my experience has been it doesn't necessarily decrease the quality of services, which is awesome. So I definitely am an advocate for telehealth, and EMDR can definitely be done. You use a different method for your eyes to move. There's a dot on your screen that the therapist can control, and your eyes follow that dot. And otherwise it's actually quite similar. And I have a couple clients who I had tried doing EMDR with them in person, and we were having difficulty, and for whatever reason, being in their own home, on their own bed, for some reason, has sort of allowed them to access more of those feelings, and it's actually worked better. So
interesting. I know my mom's mentioned, she was like, I really appreciate the time I have when I do it over my computer with Rosey, where when we're done, I can just take a rest for 30 minutes and have space and time by myself just to kind of process through the work we did that day. And so I know she's appreciated that privacy of her being in her own home and the comfort.
Yeah, I think there are perks.
Yeah, that's so interesting. So if there are parents that, or anyone really, that feels, if you feel too busy or if it's impossible to get childcare, then telehealth really is a great option for that. And I'm excited to hear about the EMDR working so well.
Yeah.
virtually. That is so cool.
Yeah, it really is.
If someone does want to try out EMDR for themselves, how would you recommend going about that?
Yeah, so the good news is EMDR is definitely a growing therapy. So there are more and more therapists available, though it still can be hard. So I would say probably the easiest way to find an EMDR therapist would be to go to their society that's been created that therapists basically register with, and then
Oh,
you
okay.
can find a therapist that way. So you would go to emdria.org, and then on that website are lots of resources involving EMDR, but one of those resources is to find a therapist who
Okay.
can provide EMDR in your area. And it's kind of cool because most people have a picture. You can look at their profile and you can see like if there's someone who's actually teaching EMDR, which would probably indicate they have a lot of experience in EMDR
Right.
versus being someone who's just providing, which I think even someone who's just providing would often be a great option. And
Yeah.
then the other resource on that website is there is a great page about what is EMDR, and there are things you can read. There's actually a video where they sort of show what it looks like, so you could also look at that if you're wanting to learn
Oh,
more.
interesting. Awesome. Yeah, I'll put the link for that in the show notes so people can find a
Perfect.
therapist that is certified in that and fix yourselves.
I
Because
love
that is the theme.
I, I love that catchphrase. You should make a t-shirt or something.
Like the new, I'll submit it to like the EMDR Society or
Yeah.
something. This is what your little
That's
like, yeah,
funny.
your catchphrase should be.
Yeah, your catchphrase.
Well, this has been awesome, Rosie. Thank you so much for joining us today.
You're so welcome.
And I really hope that people can find healing in one way or another, but specifically, since we're talking about this today, through EMDR, the way I did by coming to see you. You can find links in the show notes for the website Rosie referred to, EMDRIA, both to find a therapist, and there's also a video on there that's really great explaining more about EMDR therapy. In the show notes, you can also find an affiliate link for BetterHelp.com with that 10% discount. If there's anyone in your life that you think could benefit from listening to this episode, please share it with them. Join me next week with my solo episode all about the NICU, which was our initiation into medically complex parenting. See you then.